Okay, guys, so obviously this is not necessarily every single thing that could possibly be on the lab practical, but it's pretty much most of our models that we use for both the respiratory system and the digestive system. And I'll kind of try and point out all of the possible things that could be shown on each model, just to give you an idea of like what it might be like, what types of things you're going to see on the lab practical. And again, it's going to go through the respiratory system and the digestive system. So this is the model that we used. This is the model that we use for the liver. This view is the view that I used for most of the different structures for the liver and the gallbladder. I'll show you, there is another view where you can see the bile duct or the common bile duct making its way down to the duodenum or the duodenum. But this is the view where you can really see all four lobes, you can see the ducts, all of that. So when you look at it, remember the liver has four lobes, right? The right, left, caudate, and quadrate. So you can see them all right here. The largest lobe of the liver is the right lobe. So when you look at it, you see that this side is biggest. So that would be the right lobe, right? Or you could say right lobe of the liver. That means that this over here is the left, right? So if I were pointing to this and I said, let me change that. Yeah, and it would probably say like identify the lobe of the liver. You can just say right lobe. And if this side over here is the right, that makes this other side the left. So this one over here would be the left lobe. The other two lobes, there's one right here, and then there's one right here. This one up right here is the caudate lobe, C-A-U-D-A-T-E. Caudate. It means finger-like, and that's kind of what it looks like a little fingers wrapping around. And what does quad mean? Four, exactly. So if you look at this lobe down here, it's got these four perfect right angles, right? So that's the quadrate lobe. So those are the four lobes. Also, there are a couple other features of the liver. One of them is this kind of white line that you see right here. That white line that you see right there is called the falciform ligament. Okay, falciform ligament. Also, when you look at this, you can see some like different vessels present. All of these red vessels right here, those are just the hepatic arteries. The blue vessels, actually it looks more teal, but the blue ones are just the normal hepatic veins. And then this kind of grayish purple color, these are the hepatic portal veins. So remember there's weird circulation when it goes to the liver, right? There's hepatic portal circulation. That kind of purplish gray is showing you the hepatic portal vein. This actual like black arrow that's on here is pointing to the gallbladder. This green structure right here is the gallbladder. Remember, the liver makes bile, and then the bile goes and it's stored in the gallbladder, and it gets concentrated until we need it, and then the gallbladder contracts and the bile gets pushed down into the small intestine. There are a bunch of ducts, little tubes that are present that collect the bile and transport it. So there's a whole series of tubes that you guys need to be able to identify. First are the hepatic ducts. Those are the ducts that just collect the bile from the liver, right? Hence hepatic. Hepatic is liver. So you have the left and right hepatic ducts right here and right here. So you've got to figure out left and right. How could you figure that out? Perfect. The lobes of the liver. You know that the large lobe over here is the right lobe. So that means that the duct on that side is the right hepatic duct, and then on the other side is the left hepatic duct. Where they come together, so this one right here, that's the common hepatic duct. Then coming from the gallbladder, we have another duct. This duct that leads away from the gallbladder is the cystic duct. Cystic refers to a bladder. So like cystitis is when we have like a urinary tract infection, so like in the urinary bladder, right? But they're both called bladders, so like cystic. This is just referring to the gallbladder. But that's the cystic duct. And then finally, where the cystic duct and the common hepatic duct meet, so like right here, it shows the very, very beginning of the bile duct, or you could say common bile duct. That common bile duct, it just starts right there. I'll show you on another model how it goes all the way down into the small intestine. But that's just where it begins. Perfect. Yep, it meets up with the main pancreatic duct, exactly. Right, so that's pretty much everything that I think I could possibly ask you from this picture. We'll kind of flip-flop between digestive and respiratory, because that's what will happen on the practical. So this model here is showing us the respiratory tract. We see numerous different structures. First, just up top here, that's the larynx and our voice box. And then this tube right here is the trachea. And then down here is our bronchial tree, right? So all of our bronchi. Now, I would ask you, I'm not going to ask you bronchial tree. I would ask you specifically for like the different levels of bronchi. And there are 3 levels of bronchi. We used to call them primary, secondary, and tertiary, but the specific names for them are, so like this arrow right here would be pointing to the main bronchus. Now, if you're talking about both of them, so like this tube and this tube, you could say main bronchi. Bronchus is singular. I would not count you off for saying bronchi versus bronchus. But main are these first ones. If you want to be really specific, you could say left main bronchus, but main bronchi or main bronchus would be okay. Those are the ones that just split to go to the lungs. After that, we get to the lobar bronchi. So each of these little tubes that branch off of the main bronchus, so like right there, here, really everything else that's not colored, those are all the lobar bronchi. Those go to the different lobes of the lungs. Then finally, the last bronchi that we have, and on this model, you can just say really everything that's colored. All of these little tips at the end that are colored, those are the segmental bronchi. They go to the different segments of the lung. So there's like the whole lung, and then it gets split up into lobes, and then the lobes get split up into segments. So that's kind of how the bronchi go. Main, lobar, segmental. Also looking at this, when we look at the trachea, right, this tube that leads down into the chest or into the thoracic cavity, we can see that it's made of alternating cartilage and ligaments, right? So the cartilages, each of these C-shaped cartilages, they're more like blue in color. Those are called tracheal cartilages. In between the tracheal cartilages, the more like white in color little ones in between, those are called annular ligaments. So the blue is the tracheal cartilage, the white, or it's kind of dirty grayish looking, those are the annular ligaments. If we look up top here at the larynx, we can point out multiple different structures having to do with the larynx. First is the hyoid bone. This at the very, very top is the hyoid bone. Then you can see 2 of the cartilages from the larynx. You can see the thyroid cartilage, and then underneath it, the cricoid cartilage. The only other thing I might ask you are a couple of the ligaments that are present here. This ligament right here is called the thyrohyoid ligament. You can say median thyrohyoid ligament. Technically, the median thyrohyoid ligament is just right here in the middle, and then there's lateral thyrohyoid ligaments over here. So you can say median, or you don't have to. You can just say thyrohyoid ligament. but you can see it's between the thyroid and the hyoid. So thyroid. This one right down here at the bottom is the cricothyroid ligament. Okay, cricothyroid, because it's between the cricoid and the thyroid. So this is the model that I would use, or that I could use to show you the different types of teeth. Remember we said when we're looking at the different types of teeth, I told you guys that we have like 2 and then 1, 2, 3. We have 2 incisors. So these first 2 teeth are incisors. You don't have to say this, but to be very specific, there's a central incisor in the middle and then a lateral incisor. This actual question right here is pointing to this one tooth right here, which is the canine. So incisors, then canine, then there's 2 premolars, or they're also called bicuspids. And then there's 3 molars, 1, 2, and then this one back here has not erupted yet. So 2, 1, 2, 3, and it's incisors, then canine, then premolars, then molars. This here is showing us the intestines. We can see the majority of the small intestine, and then we can see the large intestine as well. So the small intestine is this guy that's all tightly coiled in here. It actually begins up here. The first section or first segment of the small intestine is up here, and then it comes down and circles around here. It's split up into 3 sections. The first section that would be up here is the duodenum or duodenum, then the jejunum, then the ileum. This is showing you the last section. It's really like intermingled and intertwisted. So like the way that I would identify them to you is for the duodenum, it would be like way up here. I'll show you that in another slide. For the jejunum, I would show you like right there. It's not going to be like somewhere in the middle asking you. So this is like the very end, right? You see it ends like right here. So this is towards the end of the small intestine. So that would be the ileum. Right? If I did it over here, it would be the jejunum. Also on this model, you can see, I was trying to erase that black circle. You can see multiple parts of the large intestine. The large intestine, again, is this one that goes around the outside. The first section right here, this like first little segment, is called the cecum. So if I pointed to that, that would be cecum. Also, this little valve right here, right? That's pointing to the valve between the ileum and the cecum. So that's referred to as the ileocecal valve. Also the ileal orifice, sometimes like the opening there from the ileum to ileal orifice. But ileocecal valve is referring to the fact that the way the ileum enters into the cecum, it'll allow contents to go forward into the cecum, but it prevents them from going backwards. Okay, which is good because we have all sorts of bacteria in the large intestine that we don't want to go back into the small intestine. Also, hanging off of the cecum, this structure right here is the appendix, technically vermiform appendix. That appendix would be just fine. Right? Like we talked about people getting appendicitis, that's when this guy down there gets inflamed. Then the rest of this is the colon, and we can divide it up into segments. This first section right here is the part that goes up is the ascending colon. This section that goes across the belly is the transverse colon. This section that goes down is the descending colon. The last part of the colon is this the sigmoid colon. If I was identifying that, I would kind of circle it like this. It like curves down and then up like that again, kind of like an S, right? S for sigmoid. So I would circle that last section like that. for the sigmoid colon. And then that goes down into the rectum. We can't really see the rectum here, but the rectum would be right down here. What else could I have showed you on here? Oh, I could show you haustra. You'll notice that this whole large intestine is organized into these little like pouches, right? These pouches are haustra. So I could point to them anywhere, right? I could be pointing to the pouches up here, on either side, doesn't matter where they are, those little pouches are haustra. And then the other thing I could point to would be this band right here. There's actually 3 of them, this kind of like light colored band. Those are called the Taenia coli. T-A-E-N-I-A. Taenia coli. Those are actually the longitudinal bands of muscle. Remember, the GI tract has circular muscle and then longitudinal muscle. The longitudinal muscle gets reduced. It's not a complete covering in the large intestine. It gets kind of pulled back, and it's only these 3 bands, the Taenia coli. And I think that's all I would ask you from this. Back to the respiratory system. This is the very end of the respiratory tract, right? The air goes down all of the tubes, the bronchi, the bronchioles, and then ultimately it gets to the alveoli. Okay, so alveoli are these little bubbles here. So each of these little bubbles, if I'm pointing to just one of these, okay, that's an alveolus. Okay, the plural for alveolus is alveoli. These are the little tiny chambers where gas exchange actually occurs. You'll see all these little red lines right here. Those are the alveolar capillaries. Okay, so the gas exchange is happening between the blood in these capillaries and the air in the alveoli. This picture right here, right, is this actual circle, and then the question will say identify or what are these black lines? And those black lines right there are showing you elastic fibers. Remember, the lungs are highly elastic. They're covered in all these elastic fibers, and that's how we exhale, right? We use our muscles to inhale, and then the muscles relax, and the lungs snap back to their small size because of all of these elastic fibers. Other things that I might ask you on here, the pulmonary arteries and pulmonary veins, remember, are tricky because the colors are flip-flopped. So this blue vessel right here would be the pulmonary artery, and the red vessel would be the pulmonary vein. Also, I could show you, like I could circle one of these, right, or like one of these like this, and that's an alveolar sac. Okay, a group, like a grape-like cluster of alveoli. And those alveoli are all arranged around what we call an alveolar duct. So coming down like the center of this sac right here, we have a duct. So it would kind of go up the center of it like this. And that's what this dark kind of dot is showing you. So if I were pointing to this dark dot right there in the center of it, that would be an alveolar duct. It's really like the end of the line of the respiratory tract. These up here are showing you bronchi. I won't ask you for terminal bronchi and respiratory bronchi because I don't agree with the way that they're shown on here. Again, this blue is cartilage, and there shouldn't be cartilage this far down in the mix, so I won't ask you. I won't ask you for terminal bronchus or respiratory bronchus. So I think that's everything I would ask you from this model. This, again, we've kind of talked about these structures already, but what this is showing us is up here is the larynx, and then from here down is the trachea. So we mentioned that the cartilages of the trachea are the tracheal cartilages. And then in between them, we have these little like repeating ligaments that are called annular ligaments. I could ask you the cartilages of the larynx. So specifically, that's the thyroid cartilage. This question right here happens to be asking you the cricoid cartilage. You can see right here the epiglottis, again, the hyoid bone, and then you can't see the ligament that's right here, the thyrohyoid, but you can see the cricothyroid ligament. This is showing us, before we looked at just that segment, right, just the intestines, but here we can see really most of the GI tract. This question is pointing to the esophagus, right? So the esophagus is this long muscular tube that leads from the pharynx or throat down into the stomach. So this structure right here is the stomach, and there are multiple segments of the stomach that you guys should know. If I highlight this part of the stomach right here, that's the lesser curvature. I could ask you for the membrane that connects to that lesser curvature, and that's the lesser omentum. Those are the only couple questions that I might ask you verbally, are the membranes. I might point to this and ask you what membrane attaches here, and then that would be the lesser omentum. Or I could just say, you know, identify this part of the stomach, lesser curvature. And then there's also this larger curve on the other side of the stomach, and that would be the greater curvature. And the membrane that goes from it, greater omentum. Also, when you look at the stomach, you can see here the stomach has been opened, and the inside membrane of the stomach is folded. Those folds are called rugae or gastric folds. Either one is okay, gastric folds or rugae. Also, the stomach has multiple segments or like parts to it. This first part of the stomach right here, it's mad at me, thank you. This first part of the stomach right here where food just first enters is the cardia. Then this, like if you draw a straight line over from that, the part that's above it, this bulge that sticks up towards the top is the fundus. The main part of the stomach here is the body. And then this last part that curves up to go towards the small intestine, that's the pyloric part, or you could say pylorus. Now, as the contents of the stomach goes from the stomach into the small intestine, it goes through a sphincter, right? There's a circular band of muscle that controls stuff going from the stomach to the small intestine. So like right here is where it is, and that's the pyloric sphincter. Then I told you guys that the very first part of the stomach we couldn't see, the very first part of the small intestine we couldn't see down here. It's actually up here. So this is the very first part of the small intestine. That's the duodenum or duodenum. So that's the duodenum, and then the jejunum, and then the ileum. Also, on here, you guys can see the pancreas is back here. Okay, and the pancreas is important for digestion. It makes a bunch of digestive juices, and then it pushes them into the duodenum. Okay, so the way that the juices get from the pancreas into the duodenum is through the ducts. So the white lines, like these white lines that you see there going through the center of the pancreas, those are the ducts. The line that comes all the way down the center and then it goes down at the very end, that's the main pancreatic duct. And then there is a little accessory duct. Trying to see, I can't zoom in on this, but right here at the very end, like the duct comes down like this, the main duct goes down, and then there's a little segment that goes up. That little segment is the accessory pancreatic duct. Now the main pancreatic duct meets up with the common bile duct. So the liver, it's not all separated like this, it's just pulled apart so you can see it. Everything's actually like on top of each other. But the liver, we already looked at the ducts, right, that come from the liver and the gallbladder. And the main bile duct comes down, you can kind of see it in green, and it meets up with the main pancreatic duct. So the main pancreatic duct is like that, and then the common bile duct comes down like this, and they meet up with each other to go into the duodenum. Where they meet up with each other, so like that segment right there, is the hepatopancreatic ampulla. And there's a sphincter there that controls the flow from the pancreas and the gallbladder, and that's the sphincter of the hepatopancreatic ampulla. It's also referred to as the sphincter of Oddi, O-D-D-I, but we're trying to get away from naming things after people. So the sphincter of hepatopancreatic ampulla. Trying to think what else. The pancreas does have a head, neck, body, and tail. It's really hard to see on this though, but the head region would be like right here, and then the neck is just really thin, and then most of this is the body, and then the tail is just the very end where it goes towards the spleen. What else? Oh, down here. Remember, we went through the intestines, right? And we had the large intestine. We had the descending colon over here, then the sigmoid colon. Then the very end of this is the rectum. Right, so this is the rectum, like the last 5 inches of the GI tract. And then here at the very end, we have the anal sphincters. And there are 2 anal sphincters. The outside, so like right here and right here, that's pointing to the external anal sphincter. And then just inside that, there's a little band like right here and right here. And that's the internal anal sphincter. What else have I forgotten? Oh, membranes. So you'll notice, see there's this membrane right here that attaches to the transverse colon. And that is, the membrane is the transverse mesocolon. Okay, so the transverse mesocolon. And we talked about how the lesser omentum will connect to the lesser curvature of the stomach, and the greater omentum will connect to the greater curvature of the stomach. The other membrane that's mentioned in the lab manual is called the mesentery, or mesentery proper. And that's the membrane that kind of goes in between all of these like little curves of the small intestine to help support it and kind of hold it all together, because it's really not structurally strong otherwise. I honestly don't know that I did, but if I did, I would ask you, you know, just to identify the membrane that goes in between all the curves of the small intestine. Like shown anywhere. Yeah. When you look at this model up close, and you'll probably be able to see it if you kind of zoom in on your computer, you can kind of see yellow shading. That yellow shading is showing you it because there's a lot of fat in the mesentery. So that's why it's yellow, because of that. But yeah, it's not really shown well. It's actually very substantial, like in reality. Yeah, I don't think it is. Yeah. Sigmoid mesocolon, yeah, I won't ask you the sigmoid mesocolon. There is, the sigmoid mesocolon has a membrane like the transverse mesocolon does, but yeah, that's not shown anywhere, and I haven't. Yeah. What else? Oh, the lower esophageal sphincter. So this picture we said was pointing to the esophagus. Remember, at the very bottom of the esophagus is the lower esophageal sphincter. And that just, it contracts right here and it forms like a lid on the stomach. Because remember, the stomach's full of gastric acid and we don't want that going up into our esophagus. That hurts. It feels like heartburn or reflux. So that sphincter helps to prevent that. It's also called the cardiac sphincter because it's right by the cardia of the stomach. So this model has a lot of like the very beginning of the respiratory tract, because when we looked at the respiratory tract, we just said, okay, air goes in right here, and we just followed the pathway that air took as it went down. So when air first goes in, right here, these openings into the nasal cavity are called the nares, or just one is nares with an I. And then this first little chamber right here, that's called the nasal vestibule. Then the whole area, so this whole segment is the nasal cavity. Okay, the internal chamber of the nose is the nasal cavity. Now, the nasal cavity, remember, is not smooth walled. The walls of the nasal cavity have these bony protrusions, right? Like these right here are showing you the bony protrusions that come and curl out to increase the surface area of the nasal cavity. And those are called conchi. It's spelled like a conch shell because they curl like a conch shell. So they are the superior, middle, and inferior nasal conchi, or conchae for multiple. Now, those divide the nasal cavity up into these passageways. So when air comes in, it's got to flow through one of these kind of swirling passageways. Those are the meatuses. So the actual bony shelf, that's the conchi. The passageway is the nasal meatus, right? And again, there's the superior nasal meatus, middle nasal meatus, and then inferior nasal meatus. And it'll be clear on the exam. Like I'll make it clear whether I'm talking about this bony shelf or this passageway.
Things like the middle one, so you want us to put middle and
Mm-hmm. Yep, yeah, so identify whether it's superior, middle, or inferior. Distinguish which one, yeah. Yeah, or it'll be very like, yeah, like that's definitely the bony wall. So the conchae. Okay, so right here, we go from the nasal cavity back into the pharynx, right? And the pharynx is just a fancy word for the throat. So from here down till we go down to the esophagus is the pharynx. Now the pharynx is split up into three sections. The first section, it goes from the back of the nasal cavity to the end of the soft palate, right there. This first section is the nasopharynx because it's behind the nasal cavity. Then from the end of the soft palate to the hyoid bone, which is like right here. So this section is the oropharynx. And then the last section from the hyoid bone down till we get to the esophagus, it's back behind the larynx, so it's the laryngopharynx. The way I will ask you guys that is I'll just have part of the pharynx like highlighted. So I'll like say, okay, identify, you know, that part of the tube, or that's part of the passageway. I don't know exactly how I say it, or identify this part of the pharynx, right? What one is that? Oropharynx, right? Exactly. And you can see that, right? If you go through the oral cavity, you go right into the oropharynx. A couple other structures that you guys should know in relation to the nasal cavity and oropharynx. The roof of the mouth, this bony structure right here that forms the top of the mouth and the bottom of the nasal cavity, that's the hard palate. And like when you reach in your mouth and push at the top of your mouth, that's the palate, right? So hard palate. Back behind that, there's a muscular portion of the palate, muscular and membranous portion called the soft palate. And then dipping down below that is the uvula. And that's what you can see hanging down in the back of your throat when you say really big, ah, you see it hanging down, that's the uvula. Also, right here, this tube that you see right here in the nasopharynx is the opening of the auditory tube. Clinically, we frequently will call it the eustachian, the eustachian tube. That tube connects to the middle ear, and that's how we equalize pressure in the middle ear so we don't blow out our eardrums. So like that's when you feel your ears kind of like pop, that's you know, equalizing pressure. Also, we have the tonsils. You guys should be able to identify the three different types of tonsils. So back here, right behind the nasopharynx, we have the, well, you can call it the pharyngeal tonsil, right? The back of the pharynx, pharyngeal tonsil. That one's also the one that we refer to as the adenoid. The palatine tonsil can be found, so we said that the palate was up here. So if you just go to the palate and drop down, right here, the lateral walls of like the back of the throat, you'll find the palatine tonsil. Palatine tonsil. And then this here is your tongue. Your tongue's this really big, like purely muscular structure. But right at the base of the tongue, right here, you have the lingual tonsil. Okay, so that's everything for the mouth and the nasal cavity. This actual image right here is pointing to this cartilage piece right here, which is the epiglottis. The epiglottis. And you guys, it's really hard to see, like the larynx is right here, but it's the way that it's been cut is kind of hard. Like the thyroid cartilage would be right here and would be wrapping around, and then the cricoid cartilage is right here. And so then you can see like the piece that comes up right here is the epiglottis. And then right back there, that goes into the esophagus. We already looked at the same model, right? We saw the main bronchi before. So what's this one showing you? Good, the segmental bronchi, right? Remember, all the colored ones at the end are the segmental bronchi. I think this is almost the last one. This is just showing you guys the lungs as a whole. So there are a few kind of important things that you can get off of this. One, what this is pointing to is this muscle that's down here. Exactly, which is the diaphragm. Right, that dome-shaped muscle that's right underneath the lungs. You can kind of just see like the border of it right there, and then you can see it all underneath. Then we see the lungs themselves. And on the lungs themselves, we have the left lung on that side and then the right lung on this side. And they're a little bit different from each other, right? Remember, the right lung's a little bit bigger. The right lung has 3 lobes, the left lung has 2 lobes. So when we look at them, there's a fissure right here. A fissure, remember, is just a groove, like a deep groove. That's the, good job, oblique fissure. Oblique just means it goes at like a diagonal angle. And then there's also a fissure right here. Good job. That's the horizontal fissure. Now that divides the right lung up into 3 lobes, right? 1, 2, 3 lobes. So the superior lobe up top, the middle lobe in the middle, and then the inferior lobe at the bottom. The left lung over here only has this one fissure. So that's dividing it up into only 2 lobes, right? The superior lobe and the inferior lobe. No, you don't. Also, this notch right here, notice there's this little like section that's taken out because of the heart, right? Remember, the heart has more mass on the left, so there's not as much room for the lung. So what did you call that? Good job. That's called the cardiac notch, right? It's literally a notch that's taken out for the heart. Okay, so this is the last one. This model is showing you an example of the wall of the GI tract. So the wall of the GI tract in general has 4 layers. And it typically has 4 layers. There's the, let me change colors. There's the, come on, there we go. The inner layer, so like this is the lumen inside the GI tract. Okay, this would be outside the GI tract. So this is what like the whole wall of the GI tract would look like. And it's got 4 layers. This is the inside layer then that comes in contact with the food. Good, that's the mucosa. Right, we think like mucus, it's covered in mucus, mucosa. Deep to that. Good job. Submucosa, because it's underneath the mucosa. Deep to that. So yeah, or you can call it, I'm stuck calling it muscularis externa. That muscularis externa helps me because there's this muscular layer here as well, which is the muscular mucosa. Muscularis mucosa by the mucosal layer, muscularis externa is the external layer. And then you can barely see it on here, but there's this tiny little like outer layer right here. You can just see the very edge of it. And yes, good, that's the serosa. So this, and you guys will notice with the muscularis externa, the muscular layer here, that there's typically 2 layers of muscle, right? Like there's the 1 layer of muscle and there it is. There's a circular layer and a longitudinal layer in most parts of the GI tract. So this question right here is asking you for that layer, right? So that would be the submucosa. These structures right here, these little like finger-like extensions, those are called villi, or just one of them. If I had, you know, just one of these, batteries are running out on this thing. If just one of them were circled like that, that would just be a villus. Those are only present in the small intestine, right? They're there to increase the surface area of the small intestine. What else? Oh, this green in the very middle, there's like this green tube that comes up it. That's a lacteal. It's part of the lymphatic system. And then finally, you'll see like, so this like kind of, I don't know what color that is, like peach color is showing you the lining, and then you'll notice that it drops below the surface. This part right here where it drops below the surface, that's an intestinal crypt. They're frequently also called the crypts of Lieberkens, but again, we're trying to get away from people's names and name them for like what they actually are. So intestinal crypt, that's where the actual glands are for the intestines. Like that's where, you know, enzymes and whatnot are made, and then they get pushed up here. But that is it. That is all that I would ask you from this model. Okay, that's it. That's the last one. So that's the types of stuff that you'll see. I might have like skipped over a few structures that are on there, but like these are the models that you're going to see. This is the type of stuff that I'm going to ask you. For the most part, it's all going to be just straight anatomy, like just identifying each of the structures, not like functional type stuff. The functional type stuff will be in lecture. Okay, let me stop.